Hi guys, my name is Allison Pritchard. I'm a student athletic trainer at Seton Hall University, and today I'm going to be giving some rehab exercises for an MCL sprain 3 weeks out and a lateral malleolus bone bruise. So my goals for the grade 1 MCL sprain is to continue to increase muscle strength using both legs and then hopefully progressing them to some single leg work for their progressions of the exercises. The precautions are going to be excessive leg extension, lunges, squats past 90 degrees, and any high impact exercises. With the lateral malleolus bone bruise, the patient is having some pain while weight bearing. He's able to do it, but it does bring him a little bit of pain. So my goals for the bone bruise were to strengthen intrinsic muscles in the foot and ankle, and then precautions were to stay away from any loaded exercises. Having the bone bruise is going to have to make us take a step back with some of those MCL exercises because it's going to be as tolerated with the pain on being able to put any pressure on that ankle. So I'm going to stick to open kinetic chain exercises as well as body weight exercises, and I'm not going to do anything loaded to put any extra weight on that ankle. So the first exercise we're going to do is called long arc quads. This is going to help strengthen those quadricep muscles. So here we're going to have the patient seated nice and tall in a chair, and what you're going to do is you're going to bring the foot up until the knee is in full extension. You're going to want to hold here at the top for 5 seconds and then slowly bring your foot back down. The regression for this is going to be short arc quads. The only difference is you're going to get a pillow or a folded up blanket and place it under the knee, and this is just going to be a little less range of motion on that knee joint. But the same thing here, all you're going to do is bring that foot up and strengthen the knee, hold there, and then return back down. So for the progression of this, we're just going to add some weight. So if you have an ankle weight, you can use that, or in my case, I'm using heavy shoes just to put those quads under a little bit more of tension and put a little bit more resistance to the exercise. Next exercise is clamshells. So this exercise is used to target those hip abductors, especially the glute medius. So with this, the patient position is going to be side lying with your knees bent at a 45-degree angle. You're going to want to rotate that top leg up while keeping your hips stacked and your core engaged. You also want to make sure your feet stay together at the bottom. The regression for this exercise is just going to be using a less resistant band or decreasing your number of reps. The progression of clamshells is going to be monster walks. So what you want to do is get in a nice athletic position. You're going to take a step forward and out with one leg, bring the other foot forward, and then do the same thing with that opposite leg in little segments. You want to stay low, keep that core engaged, and limit any twisting. The next exercise is standing hamstring curls. This is going to be used to strengthen the hamstring muscles. The patient position is going to be stand facing a table or a chair for balance and support. Next, you're going to balance on one leg, and then on that other leg, you're going to bend up, bringing the ankle towards the buttocks. The regression for this exercise is going to be doing less reps. The progression for this exercise is going to be adding a resistance band, heavy shoes, or increasing the reps. Here I have a resistance band at the bottom of the chair put on my ankle to give that a little bit more resistance to the exercise. The next exercise is single leg balance. These are used to strengthen the intrinsic muscles of the foot and knee and then overall improve balance. The patient position is going to be standing shoulder width apart, and then when you're ready, lift one foot off the ground. With this, you want to focus on not letting the legs touch each other, and you want to engage that core. After 30 seconds have passed, you'll switch legs. The regression for this is going to be decreasing your time holding, as well as you can use a chair or a table for some balance and support. The progression is going to be increasing your time, so try to shoot for a minute, or you can close your eyes like I do in the video, and one other thing you can do is do it on a foam pad. The next exercise we're going to do is body weight squats. This is going to strengthen the quads, hamstrings, and glutes. Patient position is going to be standing shoulder width apart. You're going to want to hip hinge, then bend those knees and drop the hips to lower yourself. Then squeeze your glutes and push yourself back up. Here we want to focus on not going lower than 90 degrees, especially with that MCL sprain. Try to focus on keeping a nice level back and engaging that core. The regression for this is going to be sit to stands. What you're going to want to do is grab a chair, feet shoulder width apart, and then lower yourself onto the chair. Once seated, push yourself back up to standing. The progression for this is going to be goblet squats. This is going to be the same thing as a body weight squat, except you're going to grab something with some weight. If you don't have a kettlebell or some kind of weight, you can use household products. The final exercise is calf raises. This is used to strengthen the gastroc and soleus muscles. Patient position is going to be standing shoulder width apart, facing a table or chair for support. With your hands on the table or chair, you're going to push up onto your toes and then bring yourself back down. The regression for this is going to be doing less reps or calf raise holds. You'll hold at the top for 5 seconds and then bring yourself back down. The progression for this is going to be single leg calf raises. With this, you're just going to balance on one foot, going up on the toe, and then bringing yourself back down. Another thing you can do is focus on that eccentric motion down, so going 5 seconds down to the bottom. So a lot of the progressions and regressions of these exercises are going to be based on the grade of the injury. So if it was a grade 2 MCL sprain instead of a grade 1, we are going to be progressing a little bit slower. I was doing this as if he was a grade 1 and he's trying, and he's at a good place at 3 weeks, starting to do some more loaded exercises. Again though, as soon as his ankle starts feeling better, we can start doing some more resistance training, loaded exercises, and starting to get him to do some more plyometric stuff to return to play. So a lot of it's going to be based on that ankle injury at first. But again, a lot of it's going to be based on how he's feeling and if he thinks the exercises are too much or not enough. If he comes in the next day and he's super sore and we pushed him a little bit too hard, we know that for next time. It's going to be a lot about what the athlete's telling you and how they're feeling.